She came in on a Tuesday afternoon. A 7-year-old border collie named Rue. Her owner was a retired teacher who had raised that dog from 8 weeks old. She brought her in because Rue had started walking strangely, a slight hesitation in the back left leg, a subtle shift in how she carried her weight. The owner had Googled it. She thought maybe arthritis, maybe a pulled muscle. She had done everything right. Premium food, regular vet visits. She loved that dog more than most people love people. When I examined Rue, the first thing I noticed wasn't the limp. It was her nails. They had grown so long that they were curling inward at the tips, pressing against the ground at an angle her foot was never designed to handle. When I put a flat surface under each paw and watched her stand, I could see it immediately. Her entire skeletal alignment was off. Her toes were being pushed backward, her wrists were compensating, her hips were rotating to redistribute weight away from the discomfort, and her spine, her lower lumbar spine, was being asked to do work it was never built to do, day after day, for what I estimated had been at least 2 years. The limp wasn't arthritis. It was her body running out of ways to compensate. Her owner sat across from me and said, "But I trim them every few months. Is that not enough?" Here's what nobody had told her, and what I'm going to tell you today. By the end of this, you'll understand exactly what's happening inside your dog's body when their nails go too long. And you'll know the specific things you can do about it, starting tonight. Most people think of nails as cosmetic. A grooming issue, something you deal with when they start clicking on the floor or scratching the hardwood. And I understand why. That's the only feedback most dogs give you. The clicking, the scratch marks. Nothing that sounds like a medical emergency. But here's what I want you to understand, and I want you to hold this image in your mind while I explain it. Think of your dog's body like a building, a well-designed structure. Every load-bearing wall in the right place. Every beam carrying the weight it was engineered to carry. Now imagine someone quietly, slowly, imperceptibly tilts the foundation. Just a few degrees. Not enough to see from the outside. Not enough to feel in the short term. But over months, over years, the walls start to stress. The joints start to wear unevenly. The ceiling cracks. By the time you see the damage, the foundation has been wrong for a very long time. That's what overgrown nails do to your dog's body. Here's the mechanics of it. When your dog's nails make contact with the ground before the paw itself does, which happens the moment they get past a certain length, it forces the toes to splay and the foot to angle backward. This changes what's called the ground reaction force, the physics of how the floor pushes back against your dog's weight with every single step. Your dog takes somewhere between 15 and 25,000 steps a day. Every one of those steps is now traveling up the leg at a slightly wrong angle. The first thing that absorbs this is the paw, then the carpus, that's the wrist joint in the front legs, then the elbow, then the shoulder, then the spine. These structures are not designed to absorb that kind of redirected force indefinitely. Think of it like driving a car with the wheels slightly misaligned. For a week, you don't notice much. For a month, there's a small shimmy. For 2 years, your tires are worn through on one side and your suspension is damaged. Your vet isn't hiding this from you. I want to be clear about that. The problem is that a routine vet appointment, a wellness check, rarely includes a formal gait analysis or a postural assessment. Your vet has 8 minutes. They check the teeth, the ears, the coat, the weight, they press on the abdomen, they listen to the heart. Nail length gets mentioned if it's obviously severe. But the cumulative damage from nails that are a little too long for a little too long, that's not something that shows up on a standard exam until the dog is already limping. And by then, the conversation changes. I've spent 22 years in veterinary internal medicine. I have worked alongside orthopedic surgeons and neurologists and rehabilitation specialists. I have seen the inside of more dogs than most people will ever see the outside of. And what I can tell you, from those years, from those operating rooms, from those rehabilitation consultations, is that musculoskeletal deterioration in dogs almost always has a history. a trail of small, overlooked things that compounded quietly over time. Nail length shows up in that history more than most owners would ever expect. Every time I see a middle-aged dog with unexplained back stiffness or a senior dog who has slowed down in ways their owners assumed was just aging, I look at the feet first. Every single time. Because the feet tell me things the spine hasn't said out loud yet. How did it get this far? That's the question I keep asking. And the answer, more often than not, is that nobody explained it clearly enough, early enough, for the owner to understand what they were actually preventing. So let me walk you through what I want you to know, specifically, practically. When you get home tonight, not next week, I want you to do one thing. Stand your dog on a flat, hard surface, not carpet, hard floor, and look at their paws from the side. If the nails are touching the floor when the paw is flat and relaxed, they are too long. The nail should clear the floor when your dog is standing normally. It should not be the first point of contact. If you can hear them on tile or wood when your dog is walking at a calm pace, they are too long. Now, I know what you're thinking. My dog hates having their nails trimmed. I've tried. It's a whole ordeal. I hear this constantly, and I'm not going to dismiss it. Fear of nail trimming, what we call nail aversion, is one of the most common reasons owners fall behind. The dog fusses, the owner backs off, and the cycle repeats. Here's what I want you to understand about that. Nail aversion in dogs is almost always trained, not inherent, meaning it was created by a bad experience, often the first few experiences, usually involving cutting too short, hitting what's called the quick, and causing a sharp pain. The dog files that away. And the next time you approach with clippers, that file comes out. The solution isn't to push through. Pushing through makes it worse. The solution is to systematically desensitize, which sounds clinical but just means this. Spend 2 weeks touching your dog's paws every day, casually, without clippers anywhere near them. Then introduce the clippers nearby. Then touch the paw with the clippers closed. Then take a single nail, just one, and take the smallest possible amount off the tip, the thinnest sliver. Give them something wonderful afterward. Do 1 nail per session for a week. Let them relearn that this is not a threat. I had a patient, a 4-year-old basset hound named Gerald. His owner had tried for 2 years to trim his nails and given up. She was bringing him in for professional grooming every 6 to 8 weeks, which is too infrequent, and the nails were still getting too long between appointments. We did 3 weeks of counter-conditioning at home, using exactly the protocol I just described. Within a month, Gerald would lie on his side and let his owner do all 4 paws. She sent me a video, 22 years of clinical practice, and a basset hound lying voluntarily on his back still made me smile. The frequency matters as much as the technique. This is the second thing I want you to take away. Most owners trim their dog's nails when they notice they're long. That's reactive. What you want is proactive. Every 3 to 4 weeks for most dogs. Some dogs with naturally slower growing nails can go 5 weeks. Some high-activity dogs who walk on pavement regularly may actually wear their nails down enough that you only need to trim monthly. Concrete and asphalt act like a file on the nail. Dogs who walk primarily on grass or soft surfaces get almost no natural wear. How do you know if you're on the right schedule? Check weekly. Just look. Take 10 seconds. If the nail is approaching the ground when the dog stands relaxed, you're due. Don't wait for the clicking. A 9-year-old shepherd mix named Petra came to me with what her owner described as mystery lameness in the rear right leg. No obvious injury, no traumatic event. The leg had just progressively gotten worse over 3 months. Her owner had been to 2 other vets. X-rays showed some mild spondylosis. That's arthritis of the spine, specifically between the vertebral bodies, but nothing that should have caused the degree of dysfunction Petra was showing. I looked at her feet. Her rear nails were significantly overgrown. Her hips were tilted. Her lumbosacral joint, the hinge between the lower spine and the pelvis, was under abnormal stress. We addressed the nails immediately. We started a targeted rehabilitation program focused on rebuilding the stabilizer muscles along the spine. Petra's lameness resolved by 60% within 6 weeks. That remaining 40%? Genuine arthritis that needed its own management. But 60% of her suffering had a mechanical cause that had nothing to do with her age and everything to do with her feet. Her owner asked me afterward, and I remember the exact words, "How did a nail do that to her spine?" And the honest answer is, the nail didn't do it all at once. It did it one step at a time, 15,000 steps a day, multiplied by months of misalignment. That's how it happened. Now I want to talk about something that almost nobody discusses when they talk about nails, and that's the dew claw. The dew claw is the small, vestigial nail on the inner side of the leg, usually visible on the front legs, sometimes on the rear legs depending on the breed. Most owners pay attention to the main 4 nails on each paw. The dew claw gets forgotten, and because it doesn't touch the ground at all, it has no natural wear mechanism whatsoever. It grows faster in proportion to the nails that do touch the ground. Left untrimmed, dew claws can curl completely around and grow into the skin. I have seen this. I have had to surgically remove embedded dew claws from dogs whose owners had no idea anything was wrong because the dog wasn't obviously limping. Check the dew claws every single time you trim the main nails. They are not optional. A 2-year-old golden retriever named Biscuit came in last spring. His dew claw had curved around and embedded into the soft tissue on the inner wrist. The entry wound was infected. He had been licking at it for what his owner estimated was about a week, but she had assumed it was from a scrape somewhere. It wasn't. It was his own nail. We were able to treat it conservatively. No surgery required, fortunately. But the infection required 2 weeks of antibiotics, and he was in significant discomfort during that time. All of it preventable. All of it. I want you to check your dog's dew claws tonight, right after this video. Just check. The last thing I want to address is the nail itself, the structure of it, because understanding it makes everything else make more sense. Inside your dog's nail is a blood vessel and a nerve. This is what's called the quick. In dogs with light-colored nails, you can usually see it as a pink region through the nail. In dark-colored nails, you cannot see it at all. This is why dark nails intimidate owners. They're cutting blind. Here is what I tell every owner who comes to me frustrated about dark nails. Cut small amounts, the thinnest possible sliver from the tip. Then look at the cut surface. When you're far from the quick, the inside of the nail looks chalky and dry. As you get closer to the quick, the center of the cut surface starts to look darker, almost like a small dark dot begins to appear in the middle. That dark dot is your warning to stop. Stop there. You're close enough. You don't need to cut all the way back in one session. If the nails are very long, cut a small amount now, wait 2 weeks, cut a small amount again. The quick recedes over time as you trim consistently. With dogs that have severely overgrown nails, the quick has extended as the nail grew. You cannot cut back to a normal length in one sitting without hitting it. Be patient. Weekly trims of tiny amounts will move the quick backward over several months, and you can eventually get back to a healthy nail length. That's how you do it. Slowly. Without drama. Without blood. Without your dog deciding that nail time is something to dread. Everything I've shared with you today, the mechanics of gait, the stress on joints, the spinal compensation, the dew claws, the technique, the frequency, all of it works through the same fundamental idea. Alignment. The body works best when it's stacked the way it was designed to be stacked. When the feet hit the floor correctly, the force goes where it's supposed to go. Every joint above that contact point is protected. The spine is protected. The muscles don't have to work overtime to compensate for something they were never meant to compensate for. Different doors, all leading to the same room. A dog whose body can move the way it was built to move for as long as possible. Rue came back 3 months after that first visit. Her owner had established a consistent 4-week trim schedule. She'd done the desensitization work at home, though she admitted it took longer than she expected. Rue's nails were short. Her gait was assessed by one of our rehabilitation specialists. The hesitation in the left rear leg, the thing her owner had first noticed, was almost entirely gone. At the end of that appointment, her owner stood in the doorway of my exam room, holding Rue's leash, and she said something I've heard before in different forms, but it never gets easier to hear. I had no idea something like that could cause something like this. Why didn't anyone explain it to me sooner? That question stays with me. Every time. It's part of why I sit down and make these videos instead of doing something easier with my evenings. So here is what I want you to take away. Check the nails tonight. If they're touching the floor when your dog stands relaxed, they're too long. Trim every 3 to 4 weeks as a standing routine, not a reactive response. Learn the inside of the nail. Cut small amounts, look for the dark dot in the center, stop there. Don't forget the dew claws. They are separate, they don't wear down, and they can cause real harm if ignored. And if your dog has nail aversion, don't fight through it. Work through it, slowly, with patience, one nail at a time. If all of that feels like a lot, pick just one. Maybe it's the check tonight. Maybe it's scheduling a grooming appointment for this week and asking the groomer to show you the quick on one of the nails. Maybe it's ordering a proper pair of scissor-style nail clippers designed for your dog's size, not the cheap guillotine ones from the checkout aisle. Just one thing. One thing tonight. Your dog goes everywhere with you. They've been by your side on the good days and on the days you'd rather forget. They've never asked for anything except to be near you. The least complicated thing you can do for their long-term health, the thing that costs almost nothing and takes 5 minutes every few weeks, is keep their feet right. That's it. That's all this is, and remember, your vet is your partner in this. I'm just the one who has a little more time to explain it.